Good day everyone, I'm Ian Grace Mayorga from Cavite State University main campus. I'm going to show you the return demonstration of administering oxygen via nasal cannula and simple oxygen mask. So what is the purpose of this return demonstration? We are administering oxygen through nasal cannula to deliver a relatively low concentration of oxygen when only minimal oxygen support is required. And compared to the nasal cannula, the simple oxygen mask provide moderate oxygen support and a higher concentration of oxygen and humidity. So let's proceed with the implementation of the procedure. First is the assessment. We have to determine the current vital signs and the level of consciousness of the client. So we need to get the pulse rate, the respiratory rate, and the breath sounds of the client by auscultating his chest. Can you breathe normally po? Next is we need to assess the sign and symptoms of the respiratory disease if the client has a hypoxia or any breathing problems and respiratory disease. And then we need to check the doctor's order if we are administering the oxygen to the right client. Then next is we need to wash our hands. And then next to the procedure is we need to assemble all the equipments. We have here the improvised oxygen tank and the improvised flow meter, the tape, this is optional, the simple oxygen mask, this, and also the nasal cannula. Also, we have here the tools for getting the vital signs and the moist cotton balls for cleaning the nostrils. And as you can see, we have here the no smoking signage for the safety of the client during the implementation of the procedure. And then for implementing, first is we need to identify the client. Good day, ma'am. I am Ian Grace Mayorga, your student nurse for today po. So you are, what's your name po? Okay, kailan po ang birthday niyo? Okay, so today po ma'am, we are going to administer the oxygen via nasal cannula and also via simple oxygen mask to provide you po a moderate oxygen support po. Would that be okay with you po? Okay. The next is we need to position the client in a semi-Fowler's position. And then we need to attach the nasal cannula with the oxygen source with the humidifier. Here. And then we may need to turn on the oxygen until bubbling. And also, we need to regulate the flow meter at prescribed liters per minute. Here. And then, for placing the nasal cannula, first is we need to clean the nostrils of secretion with moist cotton balls. Here. And the next is we need to place the cannula prong or upward into the patient's nose. We need to hold the cannula so the prongs are pointing up toward the ceiling and curve down towards me. So here. Towards the ceiling. And then we need to slip attached tubing around the patient's ear and under the chin. Here. And here. And then we need to tighten the tubing to secure the cannula. And for the administering of oxygen via simple oxygen mask, we need to place the mask over nose, mouth, and chin, and then adjust the strap at the nose bridge. We need to adjust the strap in the nose bridge and pull the elastic band around the back of the head. And we need to stay with the patient for a time to observe response to treatment. And then we need to remove the mask every 2 to 4 hours and wipe away the accumulated mist and assess the underlying skin. And then we need to discard the used equipment appropriately and wash our hands. For the evaluation, we need to evaluate the client for her immediate response to the administration of the oxygen. So, ma'am, are you comfortable po with the face mask? Okay. So, you have an enough supply of oxygen naman po. Okay, that's good. And then, we also need to assess her vital signs after administering the oxygen. For the breath sounds, we need to auscultate again the client in her chest. Can you do inhale and exhale po, ma'am? Okay. And we need to record the date and time of oxygen administration and the method of delivery. And then we may also need to record the flow rate and the route in administration of oxygen. And also we need to record immediate response to oxygen therapy and the subjective and objective observation of the patient. And also, we need to record the patient's comfort with the oxygen use. As you can see and as you can hear a while ago, I asked her if she was comfortable during the administration of the oxygen through the oxygen mask, and she answered yes naman. She is comfortable. And that's all for this return demonstration.